Hey everybody, it's Dr. Mo from Applied Modern Health. We're always trying to create a new normal. So today I want to talk to you guys about headaches. It's something that goes on with the majority of people. It is also somebody that when you go to the hospital quite frequently, especially for migraines. Migraines is a common term that's thrown around that not everybody truthfully has migraines. It could just be a headache. And trust me, there's times where you don't want a migraine. And there are different types of tension headaches, stress headaches, cluster headaches. And I'm going to go through this video and show you exactly how and what it is that signifies which headache you're actually having. And then also some treatment modes. I know in episode 1, what we really showed was adjusting with our hands, where you get the audibles and you get different things, and sometimes that scares people. So I want to show you today different techniques that we could use to get to the same end game, but just not use the same treatment with our hands. My whole thing as a chiro, what I really do and what I really want to get to is results. How I get there, I don't care. If you're comfortable with one treatment versus the other, you let me know. And I have to alter my game plan and my care plan for you as an individual. So we have multiple different techniques here at AMH, and we strive on doing that because we give you guys different opportunities to get better and different ways to heal and get the same results as the next person. Because everybody likes to be treated a little bit different, so we make sure we clearly do that for you, okay? So the biggest one that we want to talk about is migraines. Migraines is the half of the face. It's usually unilateral. Unilateral means one-sided in nature. You also have some symptomatology with it, such as you don't like the light. You want to sit in a dark room. That can't be confused with just an optic headache. Optic headache is when it's truthfully just in the eye, not in the side of the head, and bright colors or bright light really affects you at that point. That's when you need to see your optometrist or your ophthalmologist, and they need to check your eyes to make sure your eyes are okay. When it's a true migraine, it's one-sided in nature. You could at least get to the point where it's pounding, where something's grabbing you. It feels like your head's sort of in a vice. And you just want to crawl in a dark room, noises affect you, and sometimes nausea or different smells would really affect you, so where you start vomiting at some sorts. That's not with everybody. That's not with every migraine is for that. Not everybody begins to vomit, but it also unilateral, whole side of the head, that's typically migraine. Next one that I like to talk about that everybody says is, I got sinuses. Okay, we all got sinuses every so often, but it shouldn't be year-round. If you have sinuses during this time of year where we go from 70 degrees in wonderful Michigan one day to 40 degrees in wonderful Michigan the next day, you might have sinuses, okay? And your sinus headaches are typically here and here. So these spots right around the eyes where those sinuses like to drain. So that is usually your sinus headaches, and sometimes they could go in the eyes. You'll also get the itchiness of the eyes of that sort, scratchiness in the throat. You'll feel all those with that true sinus headache. And we do have a treatment for that, and I'll show it to you once we get to the next room, okay? Next one is tension. Tension could be classified as a hat band headache, where it comes right across the top of the head. It could also be like a stress headache where it starts in the traps and comes up, and I'll show it. Now if you could come on over here real quick. So usually when you get a stress headache or a tension headache, it starts to begin right here in the rhomboids, and it's sort of like this musculature comes up here because these traps will attach here, come down into this area, and then come down here sort of like a diamond. So the upper traps right up here gets real tense, tight, starts grabbing on the neck, starts grabbing on the back of the head, right back here in the occipital region. That's the first bone right up top here. So it starts pulling these down, and what happens is you end up getting a headache back here, which then will radiate around the ear, travel around the ear, sit in the temple, and then affect the eye. That is your true stress tension headache. And that's something that we are infamous for getting rid of for you. We will work on these muscles around this area. We will really help out this area and the headaches when it comes to that, okay? Migraine headaches. We'll go back to what we first talked about. Migraine headaches usually start all the way back here in the occipital region. When that happens there, your occipital bone, which is this first bone that comes right up here, is usually tilted a certain way. Once via x-rays, exam, or anything of that nature, we need to figure out exactly where this bone is rotated, whether it's a left is going up, right is going down, or vice versa, or it could glide backwards or frontwards. We figure that out through treatment and through our exam, and we get that fixed that way, okay? When it comes to tension as well, we need to find trigger point areas and what's going on in this area and fix that as well. All right, hey everybody. So we were just talking about headaches, and what I really want to do is get into how do we treat these headaches. So the biggest thing that we talked about was migraines at first, okay? So the migraine headaches, the way that we treat that, like I said, the suboccipital region, which is all the way up here. So if you feel back in the back of your head, and you feel right where you got a little bump in the back of the skull right here, and then you slide off that bump, that's your occipital. That's your occipital bone. So you come down here, we actually feel that, and what happens is we start to feel one side that's locked up versus the other. Different techniques that we could do. One was the actual adjusting that we did in episode 1. Go back and see that. It was fantastic, okay? I actually think we did it with Nama that day. The second one is our little activator here. These are for people that really don't like to get adjusted a certain way. They don't like to get adjusted by hands. They have different attachment points. Some for trigger point therapy, some for musculature, some for the spine. And I really like to use this one because we do like what's called an occipital lift, where we're actually increasing the space between the skull and that first occipital bone. So we could come in here, just latch on, and we just start tapping there. She really doesn't feel anything except for someone tapping onto her head, and that gets the same adjustment down as with my hands. And the way that it's doing that is because the amount of speed and force that it's doing within a short amount of time. It's probably 8 pumps per minute at 64 pounds of pressure. We're moving a bone. Okay, so that's the fantastic thing with that. We don't have to use our hands. We could use this. So migraines, occipital region, that's really where we want to concentrate and work on. Occiput and atlas, which is the second vertebrae. C2, whatever you want to call it, atlas, C2, second vertebrae, take your pick, okay? Those are the main 2 areas we want to talk about there. Sinuses. Now, can I get you to flip over on your back for me? Sinuses, so the biggest thing that I do with sinuses, besides clearing C2 and C3, because that's where sinuses reside in the autonomic nervous system. Autonomic means automatic. Stuff that you don't think about. Kidney function, liver function, heart function, so on and so forth. Your sinuses are autonomic. C3, how those nerves relate to your autonomic nervous system. Okay? But after adjusting and clearing out the spine and working on this area, C2, occiput, so on and so forth. What I like to do, I like to shake things up, is what I call it. I go ahead and I change this. This is my little massager, my sandblaster, whatever you want to call it. I don't care, as long as I know that it gets the results. I put this on here, okay? And what ends up happening is I come through right where the sinuses resides in the eyebrow region, and I'll just literally massage it out. Because when those sinuses are congested, what happens is infections like to form. When it's not moving, it's just sitting there dormant. So we start moving these sinuses all around, and it really starts to clear out and cause these headaches to go away. And it really helps them out drastically, especially if you're in the middle of having a sinus infection or any type of sinus issues or headaches, okay? So that's the way we take care of some sinus headaches along with the adjustment. Next one is a tension headache. Tension headache, once again, we're concentrating a little bit more in the lower neck region because remember the tension headache is starting from the traps, top of the shoulders. So that's something that we're dealing with at that point. So now let's have you flip back around for me. Thank you so much. So the biggest thing that we're doing with the tension headache is we're going to actually check around this area where the tender nodules are. So when we find one right here, once again, I pull out my little sandblaster again and we start doing massages. Where we're actually working on that area to release these muscles. Release these muscles, the bones become easier to adjust. It's less painful to adjust you. By no means should a adjustment ever be painful. If it is, stop me, tell me. I'll switch up my technique. I'll help you out any way possible to make sure that you're comfortable, not in pain, okay? So when we're doing this, we're just literally looking for different pressure points to see what's going on there, okay? And then another thing that I love to do with my headache patients, the world that we live in today, okay? We are on our computers, we're on our phones, we are constantly looking down. When we're looking down, what happens is we're actually losing curvature on our neck. So for example, if we're sitting here on our phones and we're down here in this position, you'll lose that curvature in your neck. So what I do with a lot of my neck pain and back pain people is what I end up doing is I find that lower portion, especially when it comes to this tension headache, that's usually the lower area. I start using this here and I say, hey, look up for me, please. All the way up, all the way up, all the way up. This is putting that curve back in the spine the way that it should be. Look all the way down now. Come on back up. So it's gonna help that curve come back in. Back down. Back up again. Perfect, all the way down. So that's headaches in a wrap, okay? I want you guys to understand what types of headaches there are and how you could figure out which one you're having. So that way you could become more informed on how to treat these. Tylenol, Motrin, all these things will actually take down the pain, no problem. You need to sleep, you need to work, I get that. Talk to your medical professional about that. But how are we gonna get rid of the issue? How are we gonna fix the primary source? That's where I come in. You guys have headaches. I want you guys to call 1-833-NEW-NORM. Give us a call. Press 1 for Livonia, 2 for Dearborn Heights. We will be there for you and we will help you out to the best of our ability. Mention this, we also give out a bunch of discounts, especially with the Educare system and WhatsApp Media. So please give us a call, especially if it's the youth. I don't want them to be taking Tylenol or Motrins for headaches. Headaches, we got your back. We have that, all right? We'll create a new normal. Have a great day, guys.